I have begun to record our session this evening. Today is September 3rd. Is that right? Oh man. Today is September 3rd, and our guest presenters are Becky members Raina Sotsky and Morris Bell. As you can see on your screen, who are going to speak about the mental health consequences of COVID-19. I want to welcome everybody. As has been our custom, I am going to be your tech host for this evening. Shoshana will be your program host. Can everybody hear me okay?
Yes.
Yes. Great, good, thank you. Tonight's session, as I said, will be recorded and will be posted on the Becky website, probably no later than sometime later this weekend. Eric has been terrific in getting all of the schmoozes posted on the Becky website, but he's very involved in making sure that all the live streaming for the high holidays is working. So that's really important, and we want to give him a little bit of leeway to get that done. But if you're interested in seeing this schmooze again or referring somebody to it, or to any of the schmoozes that we've had over the last several months, which have been wonderful, they can be found by going to the Becky website, looking under the menu heading Learning. It's the last choice under the drop-down menu, Online Schmoozes. And you'll find them all there. I hope you enjoy them. For everyone's sake, during our presentation, we ask that all participants, but our speakers, remain muted. Only if you are called on to ask a question or make a comment, etc., toward the end of the session, I'll ask you to unmute yourself, and then once you've asked your question or stated what you intended, to mute yourself again. If I pick up that there are people who are not muted and there's background noise that's distracting, I will mute them from my end. Again, if you, as I said, our question and answers will be done after Morris and Raina's presentation. If you have a question or a comment that you want us to save for the end of the session, number one, maybe jot down a note so you remember what it was you wanted to ask. But in the chat, just chat to me. You can do it to everyone, but I will be watching, I will be monitoring the chat, and I will take your questions in the order in which they come. Please do not type your question in the chat. Just type the word question or the word comment. I will make a list of everybody's name in the order, which is why I say make a note so you remember what it was you wanted to ask about. Anybody have any questions about the format of the session or about Zoom particularly yet this evening? Great. Okay, take it away, Shoshana.
Right, well, I will also welcome everyone. It's nice to see faces I haven't seen in a while. It's always surprising to me how gratifying it is to see the faces even on Zoom. When I just like, oh yeah, you're still out there in the world. I'm glad. And also thank you for being so flexible. As most of you know, we had to reschedule this talk because of the power outages a couple of weeks ago. Especially thank you to Raina and Morris for being willing to pick another date. Thank you. So I'm going to introduce Raina and Morris, although I think most of us know them, but I'll give you a little background information. Raina is a physician. She's a child, adolescent, and adult psychiatrist and psychotherapist in New Haven and Woodbridge. She's also been involved in Yale's Department of Psychiatry town halls, specifically regarding the effects of COVID-19. Morris Bell, PhD, is a clinical psychologist and emeritus professor in the Department of Psychiatry at Yale University. He's a senior research career scientist for the VA with current research programs focused on the role of neurocognitive and social cognitive deficits in psychiatric illness. He has a general private psychotherapy practice in New Haven and Woodbridge, and I would say together they have a very deep and full experience with psychiatry and psychology and mental health in the greater New Haven area and beyond. So welcome. We're very much looking forward to hearing what you have to say.
Thank you, Shoshana, for that kind introduction. I want to say that it's a privilege for us to talk to our Becky friends on such an important topic. And it is a broad topic, and so this is a survey. So that we'll have plenty of time for discussion and questions, and hopefully people will be willing to share personal experiences as it relates to what we're about to talk about.
Morris, can I interrupt you just a moment? Is anybody having trouble hearing Morris clearly? Yes, quite a few people are having trouble hearing you.
All right.
So I'm so sorry, but if your microphone isn't going to pick up more, if you could raise your voice, that would be helpful to most everybody who's on.
Absolutely.
Yeah. Okay. I talk louder.
All right, so here we go. So this is a word cloud that many of you are familiar with that concept, in which there was a survey of the kinds of words that people are using to describe what they're experiencing right now. Now, short of breath is in some ways the largest, but anxiety, lonely, trauma, cough and pain, exhausted, more pain, more pain, more pain. More than 35% of Americans are reporting experiencing increased anxiety and depression at this time. People are frightened of becoming sick. They're mourning lost ones. They have fear of long-lasting physical effects if they get sick. They're economically frightened and worried about their family's security, including food security. Fear of losing their jobs and losing their homes. And social distancing means significant losses of comfort and connection. I want to show you these two US Census Bureau household pulse surveys from April to June because they indicate that not all of us are affected in the same way. There is a significant gender difference. Women, 37 to 40%, men 29.9 to 31.4. And most interestingly, by age. This is in fact somewhat counterintuitive, that it is the highest rates of anxiety and depression that are reported are among 18 to 29-year-olds, up to 50%. The lowest is 80 years or older. And those in the middle, 30 to 60, are 30 to 40%. So why the youngest? Well, in part because they are the most vulnerable economically, and they also suffer most from the loneliness of isolation and separation, and there may be many other factors too.
Okay, I'm going to do the next one. Oh, no, you do this one.
Now, the actual illness of COVID-19 can cause psychological and psychiatric distress. While it has respiratory symptoms and there are functional impairments, there are neurocognitive and psychosocial impairments that result in cognitive changes, anxiety, depression, and for many, PTSD.
Post-traumatic stress disorder.
Yeah, post-traumatic stress disorder, because it is an inflammatory process, and inflammatory processes affect the brain. And so you can see that there are multiple paths to pathology. One is if you've gotten COVID and you have suffered from the encephalitis, there are neural changes, and that can cause mood, symptom, and other kinds of psychiatric illnesses. And if you don't get COVID, but you have stress, then maladaptive coping can also lead to that.
So encephalitis means inflammation within the area around the brain. So if it winds up affecting your brain. So I just want to make a comment that a lot of what we're presenting, I want to give credit to the person whose lecture we heard that we thought was great and well organized, and that was Andrew Solomon, who some of you may know. He's a reporter and a Pulitzer Prize winning author. He wrote Far from the Tree and wrote a memoir about his own depression. And anyhow, even if in terms of real suffering can escalate into mental illness, and mental illness requires treatment. Did we skip some slides? Really? Okay, even if the etiology is external, the symptoms are internal and require treatment. While there is a continuum of anxiety in response to the crisis from mild and intermittent to extreme, the suffering is real. While quarantine is an ancient and effective public health measure, the consequence of isolation can be severe and long-lasting. Isolation means sheltering alone or with a small number of people all the time. While for some people this can be endearing, for others it can be very stressful. We do know that touch deprivation has profound consequences on physical health. It reduces our immune response. And in fact, a number of people who live alone have gotten cats and dogs just to be able to touch something during this very long period. The fear of dying alone and going through the grief of losing loved ones alone is a significant factor in which people talk about their loved ones dying in hospitals where they can't visit. Without direct contact for funerals or rituals like Shiva, their impact is reduced. It leaves mourners at risk for mental health consequences that may last for many years. Okay, so many parents, particularly with young children, and I have a number of parents like this in my practice, have had to work full-time and take care of their kids at the same time, which has been a daunting task. And now they face the question of should they send their kids back to school so they can work more easily, and also so their children can be better educated perhaps and more socialized, but that there are risks involved. So this is stressful. The social issues that have surrounded this have also compounded the effects. The Black Lives Matter protests, masks becoming politicized, longstanding economic inequality, and healthcare disparities that leave minorities most vulnerable. I think we're missing some slides. We're missing the whole slides about the 4 different groups. Okay.
I think you skipped a couple slides early on.
Oh, okay.
Did we? Because we missed some. How could you tell, David?
Let's see. There we go. Oh, yeah.
Thank you.
Okay. So one of the things at the beginning that we didn't get to say is that there's a national effort to deal with the mental health crisis. There have been significant failures in leadership nationally, which I'm sure many of us would agree with. Also failure to deal with the mental health crisis, including lack of insurance parity for mental health services, despite our having parity laws, which is a longstanding issue. Longstanding medical inequalities have been made much worse as systems are overstretched. And this point was recently made in the New England Journal of Medicine, where basically the argument is made in this most prominent of journals that mental health consequences of C-19 will last long after a vaccine is found. So Raina?
Okay, so this is what we missed that I started to say when I talked about Andrew Solomon. So he talked about 4 groups of people. One are the group of people with adequate resources and psychological resilience that are not experiencing symptoms. A second group are people without any predisposing factors who are responding acutely to the crisis and need some help. The third group, however, are people who have never had any mental health diagnosis, but who become vulnerable with the high sustained stress of COVID. They often think this is because of their external stress and think their symptoms will go away when the stress goes away. They need treatment because their symptoms are true depression and anxiety, and they've internalized those symptoms. The last group are the most vulnerable. They are people with pre-existing psychiatric illness who are vulnerable to severe increases in their symptoms of depression and anxiety, and often will get what we call a double depression, dysthymia, superimposed on depression. Now let's see what else we missed. Oh, no,
we're back.
Yeah, I knew we missed that slide.
Yeah.
Okay.
Okay, so we're talking about special populations, right? We did that.
No, we didn't do that. So special populations that are at risk. So children with special needs can't get their usual services, which often entail many people. The chronically mentally ill are not able to benefit from telehealth, many of them, not all of them, and end up in the ER. Homeless people can socially distance and have few protective resources. The economically disadvantaged are in danger of homelessness, food insecurity, and poor access to health care. The incarcerated populations are at increased risk for COVID and for mental health consequences. Substance abuse is more severe with fewer treatment options. This is, you can.
Yeah, these are our healthcare workers who are a most vulnerable group as they try to be of help to others. The anxiety in this group is considerable. And the elderly, of course. And here I get the privilege of showing myself and my 98-year-old mother, who is masked and doing her best to live through this extraordinary time.
Of being quarantined for a very, very long time, very long time.
I want to just briefly point this out. Recently, the president of the American Psychiatric Association was invited to testify before Congress on exactly the topic of the mental health impact of COVID-19 pandemic. And we expect that even after the infectious aspect of this pandemic is over, we're going to have a mental health pandemic that could go on for quite some time, Geller told the subcommittee. And these were his recommended actions. Collect, analyze, and make publicly available data on race and ethnicity related to COVID-19 testing, hospitalization, and mortality, as well as the mental health effects of the pandemic. Enforce the parity law. Continue expanded telehealth rules beyond the COVID-19 emergency. Strengthen congressional efforts to prevent suicide. Ensure that patients who present in the emergency department with suicidal ideation or attempted suicide are referred to mental health treatment. And I'll just comment that it's less than 10% actually get a referral. Boost resources for call centers, 24/7 mobile crisis units, and crisis stabilization programs. This was his testimony before Congress.
I just want to make a comment that there are instances in which people feel like they have to quarantine and they live alone and they have depression and they quarantine and they get more and more depressed. And sometimes it leads to suicide. And the question Solomon actually raised this in a New York Times article is, you know, which is more dangerous, to see someone and touch someone or to become so depressed? So I just leave you with that thought.
So that COVID mortality is from psychological as well as physical consequences. 400% increase in suicide hotline calls during this period. Healthcare workers committing suicide, and we've had some very dramatic examples of that. All causes of death are on the increase because of consequences of isolation and despair, and substance abuse-related deaths are likely to increase. So what can help? There are individual, interpersonal, communal, and societal interventions that can all help. At the individual level, coping strategies, including cognitive behavior therapy, medications to target symptoms like anxiety and depression, working on managing your sleep, being aware of your eating and managing your eating, exercising, prayer, and meditation? What can help at the interpersonal level?
So here there have been some studies that have been done which show that hugging releases I can never say this word, oxytocin, which decreases stress and anxiety. So you can actually even hug yourself and it will release some oxytocin. You can hug others carefully, and the way they just show it is that you can lunge forward to someone and quickly and then hug them, and you're less likely to sort of get contaminated with COVID if you do that. Touching also improves immunity. It has some consequences. Yet for those with intimate partners, they need to be aware of the added significance during this crisis. Couples therapy should be sought quickly if problems arise. For those living alone, maintaining friendship online or with distance and mass get-togethers can make a big difference.
What can help at the communal level? Becky! Participating in broader conversations online with those who share your experience or views, and finding solidarity in efforts to respond to the crisis within our community. And what can help at the societal level, Raina?
Vote!
So thank you all, and we invite questions and comments, and hopefully people will share their own experiences.
If they wish to.
If they wish to, yes.
Okay, so our first question comes from Eva.
Hi.
Hi, okay.
I remember my question. So there are many ways of manipulating data, and I think they even discovered many new ones with this pandemic. The deaths due to COVID are being reconfigured, and I'm wondering if suicides due to COVID concerns, depressions due to COVID, if suicides are counted as a COVID death.
I don't believe so. That's not my area. I don't know if Rena has any insights into how the data is being organized, but
I'm not sure either.
I don't think the mental health deaths are directly seen as COVID. And this is not a news story. I think everybody believes that the actual life and death consequences of COVID are much greater than anything we see in our statistics. Do you have any thoughts on that, Eva?
No, it's just that people, they've been rewriting the COVID deaths. Those who die of pneumonia aren't dead from COVID. Those who die from cardiac, you know. So I'm wondering if at any point, people who are having problems, you know, severe problems in this pandemic, psychological problems are counted as a COVID death.
Yeah, I don't know.
No, I don't believe so. But one thing that they are doing is they're looking at deaths by any cause and comparing the rates of deaths by any cause per month this year with last year. And
how is that?
Pardon me?
How do they compare?
They compare that we see I think, I'm sorry, I don't recall the numbers, but it was a significantly larger gap than that which was just caused by COVID. So why would there be so many more deaths during the month of June this year than last year? It's more than those that are explained by COVID alone. And that's the argument. Oh, from Robert Forbes, 210 versus 186. So there's your specific answer.
Thank you, Rob.
Thank you.
I think David has a question. Yes, David?
Yes, thank you. Do you know whether this increased degree of suicide also is understood at the level of whether the manner of suicide is changing due to this illness. There's a lot of knowledge in terms of the ways people in different populations tend to commit suicide when we're not in a pandemic. And I was wondering whether there's any insight into whether that's changing.
That's not a domain I know anything
Yeah,
about.
I don't know that either.
It sounds like you know more about it than we do, Dave.
Well, the one thing I do know about is that the largest loss of life from weapons in the country is suicide.
Yes.
Much more than any other reason for death from a weapon. So with people being home and being depressed, and the amount of weapons held by citizens of the United States, didn't know whether it's going up for that reason or drug overdoses or some other reason. I would think that there are fewer people jumping off bridges because they're not going out. But that's speculation. But I was wondering whether there was any insight into the manner of suicide.
So one thing to be said on this subject is that it's white males 50 years and older who are the at greatest risk for suicide. The downturn in the economics is sure to push many people in that particular demographic to consider suicide.
And one of the things that we did not mention that really is an oversight is we did not mention domestic violence. And there has been an incredible increase in domestic violence because people are home together, particularly quarantined, and other people don't know what's going on. Kids are not going to school. They are now, maybe some few, where, you know, kids can report what's going on. There can be evidence of child abuse. So that's another thing that really has escalated during this time.
Right.
And we failed to mention that.
Right, and DCF's ability to intervene is less. You know, there are all kinds of consequences there. Thank you, David, for that question.
Rena has a comment she'd like to share.
Hi, everybody. So I am doing as a consultant a COVID's needs assessment for a community of 100 different organizations. And I think everybody was somewhat surprised to see that when the organizations were asked in my survey, what do you need money most for? What are your biggest challenges and where are you needing funds? The third biggest category was for employee wellness and morale. So there are repercussions that it's not only sort of at home in people's personal feelings, they're bringing it with them to the workplace, even if they're at home while they're working. And you know, this is sort of rolling out to affect the work world in addition to their own personal lives.
Thank you.
So Raina and Morse mentioned to me at the beginning of the session that they also would like to invite anyone who's participating this evening, I think, to share some of their own experiences if you are comfortable doing that. Raina and Morse, why don't you frame that invitation the way you intended?
All right, so
Get closer.
yes, dear. So I talk to my 98-year-old mother twice a day now. And she has made it really clear that the phone call from my sister in the morning, my call in the afternoon and in the evening, and the occasional friends that call are what keep her going. And all around her, she sees the dramatic effects of the social isolation on the other people she's in a Hebrew living home. And the diminishment of interpersonal contact. When that, you know, as you know, if you've been in those communities, having the evening meal together is one of the most enriching and important things, and being able to participate in activities, this stuff keeps people going. So I've directly seen how hard my mother has to work to find a way to stay connected and to endure this. So perhaps others have personal encounters with this that they'd like to talk about.
We can't hear you, Daryl.
I think Joanne, I don't know if it's Joanne Fudum or Joanne Rudolph.
It's Joanne Fudum.
Okay, go ahead, Joanne.
Hey, I have a similar kind of story as to Morris, in that I have elderly parents, 90 and 93, and who are in independent living facility. And I think that that's the hardest thing for me to deal with in the whole pandemic, because the isolation that the elderly have, you know, first they were all in their rooms all the time. And now we can see them outside and take them out to a restaurant outside. But still, you know, all of the people there are very unhappy, maybe not increased incidence of depression, but it's not how they want to end their lives. You know, one woman, I heard this comment, that one woman wasn't wearing her mask properly, and she was like, I can't see, I can't hear, you know, I'm isolated, leave me alone. So I just wanted to share that.
Well, and you have the other end too. You have the issues about childcare and going to work and all of that. You want to say anything about those, how COVID's affected that?
Well, for me, it's actually been positive, because I've had the experience of taking care of my granddaughter. You know, we used to take care of her once a week, but now it's like 3 days a week because she's not going to preschool. Right. She hasn't been. So for me, that's been a very positive experience. And it sort of puts life on hold for a little while, but in a positive way. So, and it's really, I can see that for other parents of small kids, it must be incredibly stressful. Yeah.
I mean, yeah, I'm going to pick up this topic myself here. Some people with whom I've been, you know, I've talked certainly over the last couple of months, I've shared this with, but we have two daughters who are on the other side of the country. Both have had babies this year. One is 10 months old and they're in Portland, and one is 2 months old and they're in LA. They are in a situation where all of the parents have been working at home. Dina, who has the 2-month-old, is still on her maternity leave, but her husband is back at work, but at home now. And they are in a situation, I would imagine that most women here who have had babies physically themselves know how stressful not only taking care of an infant can, I mean, fathers know this also, but I'm going to go a little further. And that is that there is the whole aspect, not only of your hormones kind of going wacko, but of the feeling of not accomplishing things during the day, not being able to take a shower, being tethered to a child, being trapped in your own body. And at a time when, until recently, they all felt that they couldn't even go outside of their home for fear of the immunities that the children had developed not being strong enough, were feeling at various times incredibly trapped. And as you can imagine, our kids have focused their social lives on building and cultivating community. It's very important to both of them. And at the very time they need their community, they are without the support either of family, because we can't travel there, or of the peers that they have created a community with, having the very same stresses and challenges that they have. And it has been incredibly, incredibly stressful for them. David and I are lucky. David hasn't seen them in a year. I'm lucky that I was there at the beginning of March and was able to see them and have, you know, kind of have carried that with me. And they are being wonderfully considerate, sending photos and videos almost daily so that we're not missing more than we have to miss in not being there. And we certainly Zoom together, but they are, I think they are in fact way more stressed than we are. And it's hard to see. They don't have childcare. They are balancing taking, because of the concerns and the isolation. So they are taking turns. And I know a lot of us have children who are going through the same thing, where they're working and parenting very young, demanding children and managing their own relationships and their own economic insecurity at this time, while organizations and companies are trying to figure out how do they survive at this time. And so they have the constant threat of reduced salaries or even their jobs disappearing. Okay. I think Cynthia had the next question.
Yeah. So before I ask my question, I want to just echo my experiences with senior citizens, more senior than I am, senior citizens living in assisted living. And I think we've all observed that. So thank you for talking about that. I wanted to talk about children and the effect on children and what, you know, there are children, I know school just started today. And in New Haven, it's 100% remote, but the kids are really being held to, you have to log in, you have to be there. And I think that's helping quite a bit. But there have been some kids who literally have not gotten out of the house. They don't live near parks. They don't necessarily feel safe running around their backyards or their neighborhoods because they may live in less safe neighborhoods. And this is kind of more an observation. I think as a community, I think we have to jump in and find ways to help. And as people know, I'm helping some people with that, but not, there's only so much. So is there any information about what's happening with children or what we can do? That's kind of...
For the disparities that have been there all along. Unsafe neighborhoods, the kids couldn't go outside and play before. And now it's just the ramifications of it are greater because they can't go to school and play in the playground. We are just facing the consequences of so many social ills magnified by this current crisis. And I appreciate hearing your own personal encounter with this.
So the other comment I would have, echoing Morris, is the only schools I know of that are opening, you know, with teachers and kids in school are the independent day schools, including Ezra, the private schools, where they had the flexibility. They have fewer kids and they could space the desks and they could make the accommodations. But that doesn't help kids in the inner city in which they can't do that and who may need, you know, the learning more. I mean, I think that something I read, and I can't quote it, is the consequences sort of developmentally of COVID on young children. That and development. Yeah.
I have to say, I think New Haven has been doing a really great job today, the first day of school. If you didn't log in to your Zoom, or they're using Google, it doesn't matter, you know, at a certain time, then your parent or responsible adult was going to get a phone call. So they
are trying very hard to have that structure, but it's really not enough. And I think in the past, in unsafe neighborhoods, kids did go outside and play with each other, and some adult would kind of watch them. And now that's off. So I don't know. I hope we have something happening.
What are you doing? I'm curious. You said you were doing some things. So
well, there's one family that that people know that Becky helped when they first came to the United States. And I've stayed in touch with that family, but one of the kids in the family there are a lot of kids, and some of them are in college now, so they can help, but they also have their own stuff to do and their own jobs. So one of the kids has decided that I am her adult, in addition to her mother. I mean, I keep pulling in her mother, but she called me to attend the parent conference with the principal, to write to the principal and make sure she got her computer, to be in touch. It's frustrating because I can't drive them anywhere. I can't put them in my car easily. I mean, I may do it now. As you know, I had my own health reasons for being super careful, but now I'm just in the same risk as everybody else. There was a wonderful program in New Haven, in Connecticut, as I'm an artist, of giving grants to artists over the summer to do free workshops. It was brilliant because it was a way to get money to artists that people who objected to giving money to the arts couldn't really complain about because it was training. But there was one for kids, and I was fortunate enough to find out about it and sign up. One of the kids who previously was not really doing very much. So we'll see. And I think we need more of that. We need more free ones. I mean, even if they're only $18 a session, it's hard because the kids don't necessarily show up. Like this kid went to 4 out of 5. You know, I enlisted the 17-year-old sister to make sure she went after she missed one. So, because I'm not in the same house. So what do you do? So I would love to see more grants for free workshops for kids that we can really engage them in some way. I know Zoom isn't the same as being in person, but still.
Donna, oh, I'm sorry. Are you done, Cynthia? Or I didn't mean to rush you. I'm sorry.
Pretty much, just one more thing I did is that I helped
Sure,
one of the kids organize a safe birthday party. I ordered big things of hand sanitizer. It was only 5 kids. I spent about $10 a kid. I ordered face masks, face shields, hand sanitizer, and we cut up old tablecloth, plastic tablecloth, so people could go to a park, the kids, and sit 6 feet apart. And I felt that was, I was scared, but I also thought it was much needed for this kid, and it was a lesson in how to be careful. So I think that's one of the things that we can do too. Okay.
Great. Thank you. Donna, I think, had a comment that
yeah. I most of you know, I work with a lot of elderly and people with disabilities. And so I'm incredibly busy these days. And yeah, I've seen, I have a lot of different comments. I don't want to take too much time, but I've seen death certificates for people where they died from COVID, but it's listed, their primary cause of death was, you know, heart disease or diabetes. COVID was a factor. So I'm not sure they're even being counted, which is why there's probably a disparity in the number of deaths versus the actual COVID count. So that's one comment. People with disabilities, I mean, parents who had their kids in programs and are now trying to take care of some severely disabled kids on their own are just warriors. And it's really, I'm not sure what we can do to help. My grandkids my Sarah and Tim are teachers in New Haven, and my grandkids are in New Haven schools. Been doing a terrible, terrible job. And not my kids, the school system is, you know, understandably extremely challenged. I know our younger granddaughter has dyslexia, a minor disability, but special ed doesn't seem to be happening. She's expected to sign on to the computer and do independent work for the entire afternoon, which, you know, it's just that they don't have the resources to cater to the, you know, special needs at all. And so it's a terrible thing. Now, my grandkids are going to be going to the JCC, which is because they're among the privileged with grandparents who can help out. And they're going to have some sort of program where people are going to, I don't know who it is, are going to oversee their logging on and doing stuff. And I don't know how good that's going to be, but all I can think of is, what about the kids who can't afford, it's $900 a month each. I can't imagine what the kids are doing. And that's so their parents can go and earn teacher salaries, which were frozen this year at low levels. You know, I mean, it's sort of a crazy system. Now, my other grandkids who live in Newton, Mass, which is a very wealthy community and belong to a very wealthy synagogue, they're younger. They were supposed to go to all-day daycare at their synagogue daycare. They're not doing all day, but they had the funds to build 6 outdoor classrooms, 6 outdoor classrooms for the little kids. They're going to do preschool half day, and tomorrow's the first day, and they're going to be outside almost all day. And, you know, so there were resources. So the whole income inequality and disparities in all different ways are showing up, even more so than they did. Seniors, assisted living. I mean, I had a lot of clients die in assisted living, and now the assisted living in the nursing homes are hurting for patients. I keep getting these bargain, we have space, we'll give you a free month and all kinds of stuff. So the whole, I'm adding to the depression, but the whole sort of roots in our society are going to be changing, and as they are changing now, sometimes for the better. And I think, I mean, I attended a seminar on health, the future of elder law kind of thing yesterday. And, you know, they're talking about that and how more care is going to be at home, and how technology, you know, it's going to spur on a lot of things that needed to happen anyway. So we can only hope that some of this will contribute to good results, or we can help contribute to good results, because there's going to be a lot of awful results.
Thank you. At this point, I'm actually going to ask Raina and Morris, and then maybe open it up to all of you who are participating, who might choose. You had in your slide presentation, you know, that some of the things that are helping to make things better, and you had a point for Becky, which thank you. But what I would like to know, because we are here as members of a community, are there things you think, having both been participants and observers, that we as the Becky community could be doing to be more supportive of each other? And perhaps you as professionals might have some ideas, but also all of you as interested participants, by virtue of the fact that you signed on tonight, might have things that either you'd like to share publicly now, or privately later with Shoshana and me, and perhaps even the rabbi, of things you think that we as a community can do to be much more emotionally supportive of each other at this time.
I guess one response I would have, Daryl, is that I do think beginning to have services outside was a very good thing. Could you hear me?
Yeah.
Because I think that allowed people to see each other, to be together as a community, even with masks, even socially distanced. And You know, the rabbi doesn't allow Zooming, I won't go there. But so I think particularly because of that, that's important. And I did have a question. When are we going to find out about the high holidays and who's going where?
Okay, well, I will address two of those things you just brought up. One is that it's not true that the rabbi doesn't allow Zooming. He is not comfortable with Zooming on Shabbat or festivals. But daily we have our services Zoomed, and even for Kabbalat Shabbat up until Mariv starts. So I think in all fairness, if you want to participate if you still are only comfortable participating on Zoom, there are modifications to the service, but people are certainly welcome to do that. When it comes to high holidays, believe it or not, I'm not in charge. So as chance would have it, this was the year that we were transitioning to new leadership. And it is Jennifer Meyer and Harold Byrne who are the high holiday chairs. And as you can imagine, they are working incredibly hard to create an entirely new paradigm for what the holidays are going to look like. All of the things that we spent hours discussing in the process of transitioning were not all that useful. And so they, together with the rabbi and the other leadership at the synagogue, are trying and are still in the process of trying to find a model that will meet as many of the needs, the perceived needs of the community, while still remaining safe and following the rabbi's halachic guidelines, but engaging people and trying to give them as much of a spiritual experience as they feel they can. I know that they are still working on it. And I think next week, everybody will get a very definitive idea of exactly which services will be in person, which services will be live streamed if they are taking place in person, which are not, and are only, and that you sort of have to make your own plans for, whether that's using pre-recordings from that they are busy creating, or making plans of your own, etc. They're taking it very seriously. They're trying to be very responsive. Those of you who answered their survey, which gave them information about who in the community would be attending, would be willing to attend in person, and who is not willing to attend in person, and which of the 4 major services you would choose to make a reservation at, because those are the limitations. All of that information was incredibly helpful to help format what things are going to look like. But there are about 160 people who haven't responded to that. And so they are, right now the board is starting a process of calling all the people in the congregation who have not responded so that those plans can be more formulated. So I hope that was informative to everybody who sort of has been wondering what is going on. It's even the reason there isn't anything on the website, because they are trying the best they can to be flexible and to do as much as for the congregation as they possibly can based on the need. One more comment I'll make in terms of the psychological implications. For me, this has been a very, very interesting period because, number one, most of my work at Becky, except for the ritual stuff that I do, is involved in motivating and recruiting volunteers for whatever it is. And most of those volunteers are 60 and older, the people who come forward to regularly volunteer with whatever it might be, etc. And very early on, it became very clear that all of the organizations with whom we partner for Tikkun Olam projects were not going to accept any volunteers over 60. And not only was that a challenge for them, but it was a challenge for our population that was over 60, who, because of the high percentage of volunteerism in the Becky culture, that's an outlet by which people felt they could contribute, and it uplifts people to be able to do that. And to not be able to do that, and to be dafka in the population that is most at risk and the most available usually, has been very frustrating for a lot of people, and very hard for me, because it's hard to formulate how to mesh, how the congregation continues its Tikkun Olam efforts when in fact our volunteer corps cannot do what our volunteer corps does. So how do we then change the way in which we are doing our Tikkun Olam? Also, it's the time of year I am most busy, usually, because for 23, 24 years, I've been involved in the high holidays planning 24 hours a day. And this year where I am not working and I am isolated in my house, I don't have all of that work to do. I'm not either in the Becky office or on my computer or whatever, doing all of that stuff. And I have found myself at loose ends because it's hard to find direction. And so for me personally, psychologically, that has been a challenge. Anyway, I'll turn it over to anybody else because I kind of monopolized things there. I'm sorry about that. You're on mute, Shoshana.
Okay, I'm muted. So can I take this opportunity to talk about programs next week? Does that seem like a reasonable segue? Just because we do have a lot of things happening in upcoming events, some in person and some on Zoom. On Sunday, Jennifer Meyer is leading a group of people to bring plants, perennial plants from your home gardens to help beautify the gardens at Becky. I don't know any details about it. I know it's set up for 9:30 to 12, but I'm sure if you reach out to Jennifer Meyer, she will give you any information you want, and probably anybody who has a garden probably has a few things that are growing a little more aggressively, and you know, you might want to bring them over and just help make it a nicer looking garden. Wednesday evening, we're having another Zoom meditation session with Robin Goldberg. We had a session last night. It was wonderful. I think she's very gifted. It's a way of helping yourself, helping to center. It actually is, as mindfulness can be a good stress, a good treatment for your own stress. It's a way of learning a way to put some distance between yourself and your difficult feelings, but not in a way that's just shutting them down. And that's next Wednesday evening. And on Thursday evening, Rachel Edelstein is going to talk about something she calls Majesty in the Music for the High Holidays. And that will be, and she's an ethnomusicologist. She always is interesting. She knows a lot. She's going to bring some actual music for us to listen to. And that is Thursday at 8 o'clock. And on Saturday the 12th, now I'm going to give a full disclosure. We're having a slichot service. I have never been to a slichot service, and I am encouraging, and I have the feeling that a lot of people have not come to slichot services. I'm going to encourage, I feel like this is the year to do it. You don't even have to leave your home. You know, and you can turn it off if it's really dull. But I think it's another, because we're having more limited services, limited opportunities to pray and be together, it's another opportunity to focus, prepare, think about the holidays, think about what they mean to us. It's going to start at 8 o'clock with a Havdalah service that's oriented to families and children, but everybody is welcome. We have a speaker coming from, I can never remember what it stands for, but it's JFREJ, Jewish something for educate, I don't know, economic justice, I think are the last two words.
It's just for racial and equality and economic.
Thank you. and she's going to talk about racial inequality and social justice in America, a brief talk, and then we're going to have a slichot service, which will start, I think, at about 9 o'clock. So I urge, especially those of us who've never done this before, I think this is a great introduction, and those of you who have gone to slichot service, come and compare it and see what it's like. It's going to be live streamed, so things are going to be happening at the synagogue. I don't know if there will be room at shul for people to come and join in. I guess we'll let people know if that's an option, but certainly you'll be able to tune in and watch from home. So that's my plug. Is, we've been working pretty hard to get these programs. We've put together a lot of programs, and I think it has certainly helped me stay connected and feel connected. And we've had a wide variety of topics. I think we've gotten to know each other a little bit better, because we've had speakers from our community, many of whom are here tonight. And it's just nice to hear your expertise and have you share it with us. So that's my plug for Becky and staying connected.
Eva actually did have a comment that I didn't get to before you started. So Eva, is that something you want to share now?
Sure. Regarding the high holidays, the plans are to have people attend outside, weather permitting, or inside, and people will know ahead of time which services they're going to be attending. And they will let people know. I don't think there are tickets this year as such.
There are no tickets, I don't think. Rachel?
Yeah, we had a board meeting last night. I believe Harold and Jennifer, well, actually it was back on Monday night. And my impression is that we will be sent, if not a physical ticket, the notation of which service that we requested, and I believe we'll all be able to get the first choice. And then if there are seats available for additional services closer to Rosh Hashanah, we'll be told, what additional space you could request.
Yeah.
And if you go to the Becky website, I put it in the chat, there is a place on the Becky website now, and I'm sure we'll get that in a more succinct form, where you can see exactly which parts of the service are going to be live streamed and which ones are going to be in person and which ones there'll be resources posted at the website. So some of that is now at the website for us to see, and then I believe we'll get more specific information next week.
Yeah, I think there are emails that are going out to the congregation. I also will let people know that all the seats each day will be reserved seats. So there will be specific seats to which you are, that are committed to you, so that if you don't get to services until a certain time, a later time than the starting time, those seats are available for you and they will not be given to somebody else, if you get there later than you're expected to, etc. These are all the details that everybody's been working very hard on. And I know it's frustrating because we're used to getting all of this information early and putting it up on our refrigerators and all of that. But believe me, people are working as hard as they possibly can to keep up with changing guidelines and all the contingencies that have to be dealt with. Anyway, we were going to open this up. I know we're over our time, but I feel bad since I kind of rambled on a bit before. Are there other people who wanted to share anything in terms of this evening's topic or ways that Becky can be more supportive? Donna?
Well, not that, but I do just want to say about the high holidays that since the board members have split up the list to call all the people who haven't returned their information, and it's a chore, always a pleasure to talk to people, but it's a chore. Anyone who hasn't and knows they know what they want, get it in. Jennifer is sending us, Jennifer Meyer sending updates to all of us who are making calls, like, you don't need to call so-and-so anymore, you don't need to call so if you could get it right in, or call Peggy with the information or something.
Well, and Jennifer also is accepting email.
Right.
So that was what I did, because
So
it's super easy. Just say what we want, the two of us. So that's another easy thing.
And you should know that all of the services will be available recorded, pre-recorded on the Becky website, and all of the Torah reading will be available with the full text so that you can follow along as the Torah readings are being done, and all of the Haftorahs. So all of that, not only will that be there for you to take advantage of in terms of services to which you are not participating in person for Becky, but it's also going a nice long way toward building our audio library and creating resources for people to learn new things, and in the privacy of their own home. You know, so it has offered us opportunities to look at things in a different way, as well as all of the challenges. Anybody else? Okay. Well, I think that I want to thank Morrison, Raina, and Shoshana, and I want to thank all of you for joining us tonight. I hope you've been enjoying these sessions. And again, please feel free to reach out to Shoshana or me or the rabbi or anybody else about ways in which you think Becky could be serving the needs of the community even better. Okay? Nice to see everybody.
Thank you so much.
Thank you.